Konnichiwa. Thank you so much for tuning in. Dr. Braces here. My name is Dr. Okuda, aka Dr. Braces, and I am a board certified orthodontist. That today we are going to talk about 10 common dental myths that we're going to try to debunk. So I hope you enjoy this video. Just to give you some history on me, I'm a little bit unique compared to other orthodontists. Most orthodontists will go to orthodontic residency right out of dental school. I actually practiced as a general dentist for 4 years in the United States Air Force before I went into orthodontic school. So today we're going to talk about some of these myths that I encountered as a general practitioner. Hope you enjoy. Feel free to let us know if you have any questions. Myth number 1, you only need to visit the dentist when something hurts. That is a myth. The fact is you should go see the dentist at least every 6 months. One, to have your teeth cleaned because there's plaque that calcifies that you can no longer get off as a toothbrush. You need the hygienist to be able to remove that for you. But number 2, majority of dental problems can be fixed and resolved early. And if you treat them early, they don't progress into big problems. For example, if you have a small cavity in your tooth, that tooth probably will not hurt because that bacteria, that decay has not approached the nerve yet. If you treat it early, it's probably not going to progress into a big problem. Whereas if you wait until the tooth hurts, that means that cavity has gotten so big that it's approaching the nerve of the tooth. And if the bacteria gets into that nerve, that's when you need something like a root canal or a tooth extraction. So by seeing your dentist frequently, you can make sure that small problems stay small and don't progress into big problems. Myth number 2, brushing harder cleans your teeth better. All right, so I'm going to talk about me for a second. When I was a teenager buying my own toothbrushes, I always bought the hardest bristle brush because I thought if the toothbrush is hard, it's going to clean my teeth better. And if I scrub harder, it's going to clean my teeth better. The fact is that using too abrasive of a toothbrush and being too rough along your teeth and along your gums can actually be very detrimental for the health of your mouth, especially your gums and your gingiva. So if you're scrubbing too hard with a hard bristle brush, you can cause recession on those gums. And once those gums recede, they do not come back without a gum graft. And so I actually caused recession on myself because I was using a hard brush and I was scrubbing too hard. So the important part is you always use a soft bristled brush, soft or extra soft, and you're very gentle when scrubbing along your gums. Do not go side to side on your gums. You're using up and down or circle motion on your gums. Brushing your gums is very important. You should do it, but again, it's important that you're soft and you're gentle. It will not clean your teeth better if you scrub hard and if you use a hard bristled brush. I like the electric brushes because if you push too hard with one of those, the light will turn red and it'll tell you you're pushing too hard. So those are great tools to use. Myth number 3, sugar is the only cause of cavities. The fact is, and when you think of sugar, you think of candy or soda or sugary drinks. The fact is that almost everything that we ingest, aside from water, has some sort of carbohydrate in it. Carbohydrate is just a fancy word for sugar. And so the important part of this, and a lot of people don't understand this, is our mouths, there's a certain pH, which is a level of acidity, right? So you want your acidity to be neutral in your mouth, okay? Anytime you eat or drink anything other than water, the acid level is gonna go from 7 to 2 or 3, right? And in an acidic level, which is in that 2-3 range, that's where the bacteria can thrive. So the important part of this is not necessarily the amount of sugar that you're consuming, it's how often that you're consuming sugar. And so if you're constantly eating, snacking, drinking sugary drinks, or anything other than water throughout the day, your mouth is always at an acid level, and that's where the bacteria thrive, and you're more likely to get a lot of cavities in those situations. The example that I can give for you is from the Air Force. The maintainers, those are the ones that fix the planes and the helicopters, they sometimes have to work very long, crazy hours through the nights. And a lot of times these are young kids out of high school, 18, 19, 20-year-olds. And so during those long shifts, they're drinking energy drinks all day. Well, I can tell you right now, my patients in the Air Force that needed the most work were the maintainers that drank those energy drinks all day because the acid level in their mouth was constantly at a high level. The pH level would be 2 or 3, and it could never balance out or go back to a neutral level. So that's the most important part. If you like soda, if you like energy drinks, things like that, I always just recommend that you drink them during meal times when you're already eating those carbohydrates, because you have to eat, right? You have to eat every day. So try to have those kind of drinks while you're eating, and then don't sip on them throughout the day, because that's something that will cause a lot of problems, a lot of cavities. So the sugars, again, carbohydrates are in everything that we ingest aside from water. And so if you're constantly taking in those things, it's going to cause you more problems. Myth number 4, flossing is optional or only necessary when food is stuck between your teeth. Flossing is it's so important, yet we all neglect it, including dentists. We're kind of hypocritical when it comes to flossing. So the reason it's important, and we've discussed this in previous videos, but the teeth touch, they have very tight contact points, and bacteria can get wedged between those contact points. And that's usually where cavities will form. It's where the teeth touch. So when we go and we floss between those teeth, we're cleaning out the bacteria that on those contact points and under the gums where things can get trapped and stuck. So if we're not doing that every day, you have a higher chance of cavities, higher chance of gum disease, higher chance of periodontal disease, which is bone loss around the teeth where the teeth will start to get mobile. And so that's why flossing is incredibly important, that we do it every day and not just when there's something caught between our teeth. Myth number 5, it is normal for gums to bleed when you brush or floss. So bleeding gums when brushing or flossing is a sign that you have gingivitis. Gingivitis is simply a bacterial infection in your gums. And so we have to view it that way, right? If we see bleeding gums, we should know we have an infection up there that we need to take care of. Now, does that mean we should not brush or floss because we're making our gums bleed? Absolutely not. The sign of your body telling you that you need help and you need to clean in those areas better is the bleeding gums. Again, it's important that when you have bleeding gums, you're gently brushing, you're flossing every day, but still being gentle along that gum line. And as the gums get healthy, as that infection clears out, as your oral hygiene improves, the bleeding gums will stop. Myth number 6, baby teeth don't matter because they will fall out anyways. We just talked about this. A cavity is an infection, right? That means that there's bacteria in the tooth that's causing the tooth to decay or rot out. And so if you have a cavity, even if it's in a baby tooth, it's important that you get that addressed. Now, my rule of thumb, and every dentist is different. Pediatric dentists are the experts here, so if they tell you something different, go with their expertise. But I usually tell my patients, if you have a cavity in a baby tooth, and I am predicting that baby tooth will fall out within a year, it's probably okay that you don't need to have it treated. You could just wait for the baby tooth to fall out. If we need that baby tooth to stay in for longer than a year, then we want to make sure that we get that cavity taken care of. Why? Because if that bacterial infection in the tooth spreads to the nerve, there's blood vessels in the tooth, and then once it enters the bloodstream, that bacteria can spread anywhere, right? So your infection can actually spread to other areas of your body. And so you want to make sure you take care of those things. The baby teeth are there for a lot of reasons. 1, they give us something to chew with while we wait for our permanent teeth to come in. But 2, they hold the spaces for our permanent teeth. So one of the biggest problems that I see orthodontically is if a patient loses a baby tooth early, then the permanent teeth will start to drift and shift into that space where there's now no more room for the adult tooth to come up and take its position there. And so not only are baby teeth important for chewing, but they're important for space maintenance. And so that's why every baby tooth is important. Treat it like it's a valuable entity. On a side note, what I always tell patients in terms of adult teeth is if you were to have an adult tooth extracted and you need an implant, every implant and then putting a crown on that tooth is going to cost anywhere from $2,000 to $3,000. So of your 32 functioning teeth, if you count the wisdom teeth, or the 28 permanent teeth, if you don't count the wisdom teeth, treat each one like it's worth about $2,000 to $3,000 because that's major investments. Myth number 7, teeth whitening damages your enamel. That's a myth, and I think where it comes up is because when we whiten, it makes us sensitive usually, and so we feel like our enamel is getting damaged. Actually, if you're having your teeth whitened by a dental professional, it's not going to cause you any problems. It's not going to damage your teeth. So that part is important. If you're doing it not by a professional, on your own, and if the instructions say use this whitening gel for 2 hours and you're using it for 10, yes, you can cause damage, but more than likely it'll be to your gums, not to your actual enamel. Myth number 8, white teeth are healthy teeth. That's a major myth because I've seen patients with, dark brown teeth that have never had cavities, right? So healthy teeth doesn't equal color. It actually equals, are you taking care of the teeth? Are you brushing the teeth? Are you flossing the teeth? Are you preventing cavities? Are you going to see the dentist? Now, it looks healthier, but that doesn't necessarily, color doesn't necessarily equate to more healthy. All right, myth number 9, you should rinse your mouth right after brushing. That is a myth. Some people, there's two different schools of thought there, and I'll just explain each one. Some recommend that you do rinse right after brushing, and the reason for that is you've just brushed your teeth, which means you've kind of loosened up all that plaque and bacteria that are on your teeth that can cause cavities. So by rinsing, you're getting rid of that bacteria that's now loose. Okay. Other school of thought is the toothpaste has fluoride. You've just brushed your teeth with fluoride, and so if you rinse right away, you're essentially taking the fluoride off the tooth that is beneficial. And what fluoride is going to do is it helps remineralize the enamel. In other words, it helps make the enamel harder and more resistant to cavities. So there's two schools of thought there. What I do is I like to brush my teeth. I spit the toothpaste out and I let it sit for about 20 to 30 minutes before I actually swish and rinse, because I want to get the full effect of the fluoride. I feel like that's the most important thing, but it's also important to rinse at some point. Myth number 10, chewing sugar-free gum can replace brushing. That is a major myth, because sugar-free gum, like I'll give you the example of Trident. It has a sugar called xylitol in it that actually prevents cavities. So there is some benefits to chewing gum, but what it's not going to do is remove the plaque and bacteria. And so it's still important, if you chew a lot of gum, you still need to brush and floss every day. Twice a day, brush for 2 minutes, just to make sure that you're removing the plaque and bacteria, because no gum in the world is going to be able to remove those things for you. So that's our 10 dental myths. I hope you learned something today. If you did, feel free to leave it in the comments. If you have any questions, let us know. Thank you so much for tuning in. And if you want to know how to choose the right orthodontist for you, click the link. And thank you so much. Remember, smiles change lives, so keep smiling.